we will be joined by champions global health, developing partners, and frontline leaders whose dedications continue to shape the trajectory of this program. Your presence here this morning is a testament to the power of collaboration and the urgency of our mission. As we look ahead to 2026 and beyond, let us remain steadfast in our resolve and let this review that we have today not just be a springboard for deeper innovation, but for stronger accountability and accelerated impact. Together, we can and we will achieve malaria-free elimination in Lagos State, the center of excellence in our country, Nigeria. And we'll be setting a precedent, as we always do in Lagos, for the rest of Nigeria. Thank you for your unwavering support. I wish us all a productive and inspiring session, and I welcome you all to this program. Thank you very much.
Dr. Ibrahim Akimomi Mustafa, MNI, thank you so much, sir, for that very brief opening remarks. Distinguished ladies and gentlemen, for the impact components, one update, I want to especially welcome Dr. Bimbo Oshinowo, the Project Manager, Project Implementation Unit, Component 1. She's going to be doing a short presentation on strengthening service delivery. Please can we put our hands together for Dr. Bimbo Oshinowo. Thank you so much. For this particular audience, we have just 10 minutes, so we want to specially request that all our speakers keep to 10 minutes, the time allotted. Thank you very much. Once again, please let's put our hands together for Dr. Bimbo Oshinowo as she makes her way to the stage. Thank you so much.
Good morning, distinguished ladies and gentlemen. I'd like to stand on existing protocol. I'm Dr. Bimbo Oshinowo, Director on the State Malaria Elimination Program, Lagos State Ministry of Health. I want to give a general overview of our program so far. So the table of content, introduction, core activities, the activity updates, trends of malaria case management and testing, pictorials of achievements, and consideration for review. Next slide, please. Okay, I'll give you a brief introduction on the impact project. The project, which refers to immunization plus and malaria progress by accelerating coverage and transforming services, is aimed at combating malaria and reducing preventable childhood deaths through immunization. And the goal is to reduce under 5 mortalities and maternal mortalities. And that's going to be achieved by immunization, improving immunization services and malaria services. So in terms of implementation, the component 1, which is the malaria component, is being implemented by Lagos State Ministry of Health, Society for Family Health, and World Health Organization. And component 2, which is immunization component, is by Lagos State Primary Healthcare Board. Under component 1, it's divided into two parts, with component 1A, which is being implemented State Ministry of Health and Society for Family Health, and 1B by WHO. Impact project effectively commenced September 2024, and it's going to end December 2025. So our complementation activities, prevention and support. So we provide the textile to our facilities, a lot of communication, mass media activities, and pharmacovigilance and drug resistance monitoring being conducted. We also provide malaria rapid pregnancy test kits, microscopy for our facilities. Right now, we're concentrating on public health facilities, 343 of them, which comprise of PHCs and general hospitals. And we are giving atomicillin-based combination therapy to our facilities and also strengthening referral systems. We also look at community system strengthening. That's a lot of community outreaches and engagement and capacity strengthening across all the thematic areas under prevention, appropriate diagnosis and treatment. So for activities between September 2024 and July 2025, majority of them are basically from the public sector. So if you look through, quite a bit has been achieved, but we know we need to improve. So in terms of trends, malaria positivity has shown to be on a decrease from 28% in 2024, September 2024, to 20% as of July 2025. We have also improved in our testing rates. And there's an inverse relationship between testing rates and positivity rate, because there has been an improvement in the testing rate and our positivity rate is still declining. So definitely, malaria is reducing in Lagos. These are the pictorials of activities that we have conducted. Malaria outreaches, capacity building activities, as well as commodity procurement and distribution. So what are the lessons learned and what we intend to do? We need to expand the activities to the private sector, because we know over 60% of our clients actually do visit the private sector, and private sector consists of both private hospitals, clinics, and even the community pharmacies and PPNs, referred to as pharmaceutical service providers. We want to continue our capacity strengthening in the private sector as well, refresher training and testing of protocols and quality assurance for both microscopy and MRDTs, and also track our data, which is quite important for us to have a true picture of malaria in Lagos. We equally want to improve our diagnostics balance and quality across sectors. What are we looking at? For public facilities, we want to have a targeted microscopy where appropriate, and we want to keep emphasis for MRDT, for quick scalable diagnosis, especially at the PhD level, because it's fast, quite accurate as well. And then at the same time, we also want to compare MRDT and microscopy, the data that we are obtaining from these two. Investigate high MRDT test positivity rate, because we noticed that in the private sector, the test positivity rate was 53.1%, while in the public sector, about 24%. So what we really consider is that we want to reflect on our case selection, whether it's a situation of case selection bias and quality issues in testing. Likewise, operational research would also help us know what exactly is going on between the private and public sectors. We also want to leverage community outreaches and private retail outlets more strategically and maintain high treatment rates while improving adherence and follow-up. Because despite the treatment rate, we want to ensure clients are actually doing as they expected to do, such that we do not have issues. And as the prevalence drops in Lagos State, our focus we intend looking at malaria hotspots, travel history from malaria endemic regions, and addressing non-malaria fever. They are quite critical. I would like to acknowledge the Ministry of Health, World Bank, and Malaria Impact Project partners. Thank you very much for your attention.
Please can we put our hands together once again for Dr. Ibo Shinowo. Thank you so much, ma'am.
Thank you, Dr. Shinowo. Just quickly welcome and recognize the people that are in our area. Apologies. So we have with us Dr. Ahmad Abdulwahab. He is the Executive Director of Program and Partnerships from the Nigeria Governors Forum. Welcome. Round of applause, please. We also have PCO Kunle Williams from Pest Control. Welcome. Round of applause, please. And yes, I mentioned before Dr. Aisha Adebakar, NHIA representative for Kelechi. You're welcome. And we also see quite a few other people in the room. We have the HFN president, Mrs. Njide Ndili. You're welcome. And and I see in the room as well former HFN president here, Mrs. Cleo Mashe, you're welcome. From SFH, I see Dr. Jennifer Ayanti, you're welcome. Please, a round of applause, please, to everyone. I'm sorry if I've missed people again, we'll come back again and introduce a few more people. So I hope you're all getting into the malaria situation now and you're using your hashtag malaria-free Lagos. Don't forget that. For any posts you make on LinkedIn, on any social media, just hashtag malaria-free Lagos.
Thank you very much, Dr. Singh. Ladies and gentlemen, for the Components 2 updates, I want to especially welcome the Project Manager, Project Implementation Units, Components 2, Dr. Veronica Iwayemi, for the Components 2. Please let's take a together for Dr. Veronica Iwayemi, ladies and gentlemen, as she comes forward her presentation. Thank you so much.
Okay.
Good morning, distinguished guests. This permits me to observe the protocol that has already been established. So, I'll be looking at component 2 for impact, and that resolves around immunization component. For immunization, we actually focus on 4 project objectives. Our objectives are focused on renovation, and in terms of that, we look at infrastructure upgrade. We're looking at building the capacity of our healthcare workers, the PAC staff, and also enhancing operationalization of our services, supporting health systems and strengthening our health system, and then finally, building community trust, because we understand community ownership is crucial to us as civilians. Immunization strategies, for us we have the components that focus on improving the uptake of routine immunization services, routine maternal, newborn, child health services, and also our major focus is on children under 5. And in order to do that, our infrastructural upgrades are there to help us support services. As you know, if the amenities in the PHC are not good, some people will not even utilize our services. And so it's essential that our infrastructure is upgraded. Apart from that, we're supporting quality health services to ensure that we're delivering qualitative care. We're not only building the capacity of our healthcare workers, we're also ensuring demand generation. If we provide the services and nobody comes to utilize it, then it's a waste of funds. And so it's necessary for us to generate demand for uptake of services. We're also focusing on building resilient health systems. Resilient health systems that come from both from the local government up to the state level to be able to strengthen the health system, to strengthen the leadership, the governance of the health system across all wards, and then empowering the local government for localized impact. That means through the local government health authority, we're able to ensure that they are able to provide oversight services, oversight functions for the PHCs within the LGA. So, we have indicators that have been set by the projects and targets for us. Our annual targets have been set, and so we monitor this for service delivery. In doing so, there are 4 critical indicators that we look at. The first of which is the percentage of children that are fully immunized under 1 year. That takes a look at the total number of children that are vaccinated with measles 1 vaccine. The target that has been set for us in Lagos is 90%. That's our annual target, and it's necessary to note that this is across primary healthcare centers. So right now, our current coverage as a state is at 72% for Q1 and Q2. Of course, we are yet to meet our annual target, but we are striving diligently to accomplish it. Our second indicator is looking at the percentage of children that are vaccinated with the third dose of pentavalent vaccine. And for that, the target is also 90%. We are currently at 70% for both Q1 and Q2. Now, in terms of reproductive maternal safe motherhood services, our target is to look at how many pregnant women within the community are accessing skilled birth delivery. And for that, we look at the total number of deliveries that are taken by a skilled birth attendant. And in doing that, our target has been set at 50%. Unfortunately, it doesn't show, but we're currently, right now, at 52%. So that tells us, initially in Q1 we were at 38%, and now we're at 52%. So we've been able to reach the annual target. But however, we're still striving to surpass that because we know there are more women that are patronizing community structures and not having access to skilled birth delivery. Postnatal care. It is pertinent to note that most times when a woman delivers, what is considered more important is the naming ceremony. And as such, they miss their postnatal care services. They miss postnatal care services. And so we're looking at postnatal care for mother and child. We focus on how many postnatal visits does a mother and a child have, particularly within the first 72 hours after delivery. As we know, there are possibilities of complications, neonatal jaundice, and all. And so the earlier we're able to identify that, we can prevent connectors and improve the quality of life for the child. And so initially, in Q1, we were at 82%, and currently now, we are actually at 39%. We haven't reached our target, which is supposed to be 50%, but we are striving, working hard through our particularly religious leaders, traditional leaders, to encourage women to take up postnatal care within 72 hours after their discharge. PHC renovations, if you recall, is one of our components for immunization. And for that, we're doing our infrastructural upgrades. Our infrastructural upgrades focuses on what we expect is by the time we finish, we're currently renovating 27 PHCs, of which we're at 60% renovation. By the time we finish in another month and a half, we anticipate that our outputs, immediate outputs will be, our facilities will be ready, and we will be able to have uninterrupted power supply. We're going to be installing solar panels. We will also have modern delivery rooms, consultation rooms, and waiting rooms. And then, of course, we would have improved water, sanitation, and waste management, where we'll be having all the color-coded bags within our PHCs so people know how to identify which waste and how to ensure proper waste management. We'll also be looking at ensuring that our PHCs are mobility friendly, which means the entrances will have ramps for people with disabilities. Our toilets will have also be mobility friendly as well. And then of course clear signages within the PHC so it's easy to navigate. And also clear signages because we know our mandate is to have one PHC per ward. And so it's necessary for the community to know where the nearest PHC is within their community. And so we'll have those signages that will show where the PHC is located. In terms of delivery, service delivery, once we have the renovations completed, renovation focuses on accommodation, It also focuses on improving the work environment. And so for our staff that will be on duty, they will have accommodation to be able to when they're on call. And then of course, we're equipping our facilities to be able to improve on our delivery for routine immunization, maternal care, and of course, postnatal and nutrition care. We are procuring laptops for our PHCs, and so we are enabling and making sure that these PHCs are digitally enabled to be able to provide, to be able to properly manage their data and upload their data in real time onto the HRS. So what's our priority actions for the next 6 months? Over the next 6 months, we will be advocating for a Governance Excellence Award for our PHC staff. This is to motivate the healthcare workers in terms of our PHC staff to acknowledge the hard work they're putting in and motivate others to do more. We will also be hosting our local government chairmen in an engagement meeting so that we can actually carry them along and showcase the scorecards for their local governments as per primary healthcare services. We will be finalizing our PHC renovations within 8 weeks, and we hope to hand over these primary healthcare centers to the local government. Finally, also, because we've already procured the laptops for the facilities have been procured, we will be training the health management information staff on digital tools utilization and also on data management to improve on their capacity. And we will be sustaining our clinical training and mentorship. Already we have mentors who are moving around PHCs, and we'll be also working with pediatricians and obstetricians from secondary care facilities, that's from general hospitals, to mentor our staff at the PHCs. And we'll be strengthening the capacity of the local government health authority and the World Health Committee leadership to be able to provide oversight services within their LGA. Finally, we want to sustain our monthly community engagement. We understand that it is crucial for us to have community ownership of PHC services. It is also crucial for us to make sure that in terms of health and wellness, that the local government and the community are aware we promote health, wellness, and also disease prevention. And if they do get sick, the nearest PHC is their first point of call for treatment. Having said that, the long-term impact of what we hope to achieve is that we will improve the health status of Lagosians by contributing to the reduction of maternal and child health. We're also hoping that we will improve access to PHC services. Through our community engagements, people will know where the PHC is located within their local government and the services that are provided. And finally, in keeping with the Teams Plus agenda of Lagos State Government, we're also ensuring social inclusion and governance will be addressed, whereas we will be enhancing community PHC ownership and LGA supervision of PHC services. As we're integrating services that focus on adolescent, youth-friendly, and even on elderly, we're ensuring social inclusion even for people that have disability to ensure that PHC is your one-stop shop for anything, irrespective of gender, irrespective of who you are and status. So these are just some action pictures. You can see here, Ogudu PHC in Koshofe local government is one of the PHCs we're renovating. Here you see the accommodation foundation being put in place. And then of course, in line with climate resilience, you can see we're increasing the headroom for the main building so that there's good aeration and cross ventilation. Here you see soil testing that is being performed before we started the renovations to be able to know the impacts on the environment. And then you see the piping works that are going on within the facility that is being constructed. Like I said, community engagement is crucial for us. And so you see our community engagement meetings. We've gone across the 20 LGAs, and you see us here having male engagement meetings because we understand the male factor is crucial in terms of access to service delivery. We've been intensifying our routine immunization, and particularly to hard-to-reach and riverine areas. And there you see our staff doing one of our routine immunization intensification exercise. Capacity building, if you recall, is one of our components. And here you see us. We were building the capacity of our environmental health officers on waste management, environmental and social safeguarding, so that they are aware and they can build the capacity of the community in order to be able to keep their environments safe and clean. Finally, in terms of capacity building, we've trained our healthcare workers on basic life support. And this is one of the trainings where you see our doctors performing, practicing on how to ensure appropriate basic life support is provided in emergency situations. So for us, impact is not just about infrastructure and all. It's not just about improving the operationalization and the system. It's actually about saving lives, ensuring that the quality of life for every Lagosian is improved upon, and the life expectancy in Lagos is improved. Thank you.
Thank you very much, Dr. Veronica in Wyoming. We are very grateful. Ladies and gentlemen, while she was presenting, we had the distinguished entrance of the Accounting Officer of the State Ministry of Health, who is also the Permanent Secretary, the Lagos State Ministry of Health. Ladies and gentlemen, please let's put our hands together for Dr. Olusegun Ogboye. I believe he just briefly stepped out. Ladies and gentlemen, also while the presentation was going on, we had the entrance of the Permanent Secretary, Lagos State Health Management Agency, Dr. Emanuela Zamba. Please let's put our hands together for Dr. Emanuela. Thank you so much, ma'am. Very quickly, distinguished ladies and gentlemen, for the presentation on health facility monitoring and accreditation, I want to specially welcome Dr. Olayinka Daniel. Dr. Daniel Olayinka. Please let's put our hands together for Dr. Daniel Olayinka as he comes for this presentation. Thank you so much.
Honorable Commissioners, good afternoon, sir. Permanent Secretaries hereby present, dignitaries hereby present. Thank you for giving me this opportunity to represent the Permanent Secretary, Health Facility Monitoring and Accreditation Agency, a farmer. I'm representing Dr. Abiola Ido, the Permanent Secretary, who is unavoidably absent today. My name is Dr. Olayinka Daniel. I'm the Director of Monitoring and Inspection, a farmer. So, a farmer was established by the Health Sector Reform Law of 2006 by Section 45 of the law. A farmer is the cornerstone of healthcare regulation in Lagos State, ensuring that the diverse array of healthcare facilities in Lagos State adhere to stringent quality standards. A farmer's core mandate involves setting standards for health facilities, as well as monitoring, registration, and accreditation of health facilities. A farmer ensures the facilities meet regulatory requirements, operate within defined guidelines, and deliver safe, effective, and ethical healthcare services to the residents of Lagos State. It plays pivotal role in fostering public trust in the healthcare system, improving healthcare outcomes, and preventing proliferation of substandard health facilities. So these are the current challenges being faced by a farmer, and these include limited staff capacity, inefficient processes and workflows, inadequate manpower. At present, we only have 3 medical doctors in the agency, including the permanent secretary, and we only have about 5 nurses. Presently, we don't have a dentist, we don't have medical laboratory scientists, we don't have data analysts in the agency. So, and also there's insufficient data utilization, there's no data analyst, there's hampered mobility, even though the current administration has supported the agency in so many ways. The 5 vehicles available at the facility now are being used for monitoring activities by the monitoring teams of the agency, and the inspection teams presently have no dedicated inspection vehicles. Then another challenge is inadequate engagement with our stakeholders, including the members of the public and the healthcare practitioners. So the impact project, the key strategies that we have identified for the project include expanding monitoring coverage in Lagos State, enhancing digital infrastructure of the agency, strengthening community engagement, build capacity and expertise of the staff, drive innovation and research, optimize limited resources, and interactive client communication and awareness campaign. Presently, the agency has engaged 8 private monitoring companies for the monitoring of health facilities in Lagos State due to inadequacy of the staff. Because we noted that in 2020, the agency was only able to cover 42.7% of the 367 registered health facilities as at that time. This coverage dropped to 35% in 2021 and 30% in 2022. So the private monitoring organization commenced work in 2023, and with their activities, we are able to cover 83% of registered health facilities in Lagos State. Though this dropped to about 57% in 2024 due to several challenges, including increased operational costs, especially due to the increase in fuel costs. And the expected outcomes for the impact project include increase in the number of facilities visited for monitoring by 30%, improve compliance and enhance data-driven decision-making using data analytics, strengthen collaboration between a farmer, private sector partners, and community stakeholders. 80% of registered facilities to receive timely updates from the agency, and 25% increase in compliance rates. As at the end of 2024, the agency has registered 5,847 facilities, and 573 primary healthcare facilities and 10 secondary healthcare facilities were visited for monitoring by the 8 engaged private monitoring organizations in the first quarter of 2025. 2,569 primary and secondary healthcare facilities were visited in Q2 of 2025. And this brings it to the total facilities monitored to 3,152 health facilities in the first half of 2025. We can see that when compared to 2020, the agency was only able to monitor just about 2,000 health facilities throughout the whole year, and this was just about 42% of registered facilities as at then. If you compare this value to what we have in 2020, 21, and 2022, we can see that with the engagement of the private monitoring organizations, the agency will be able to cover over 95% of registered health facilities in 2025. And during monitoring and using our monitoring tool, we discovered that 79% of health facilities had good compliance with EFAMA's set standards. So this is the graphical illustration in Q1 of 2025 with the assistance of the engaged private organizations. 21% of health facilities monitored had poor standard, while 79% of the facilities are good standard, using 60% score benchmark with a EFAMA tool. While in Q2, 17% of the facilities had poor standard, while 83% had good standards of practice. So that necessitated the sealing of some of the facilities. The number of facilities sealed in the first half of the year is 32. 22 sealed in the Q1 and 10 sealed in Q2. The sealed facilities contraventions were mainly in regard to non-registrations of facilities before practicing, in contravention of Section 60 of the Sector Law, which states that as from the commencement of the law, no person shall run or establish any facilities in the state without having registered the facility with the agency in accordance to the provisions of the Sector Law. And some of them have been reopened. And the agency inspected 118 health facilities for registration in the first half of the year. So another innovation by the agency, which is being supported by the World Bank, is the QR code innovation. The project is aimed at improving health facilities compliance digitally, as well as the regulatory efficiency of the agency, thus improving the well-being of healthcare consumers in the state. These QR codes have been generated by the agency. 6,000 have been generated so far, 2,000 have been generated so far, and about 200 of them have been pasted at the reception of registered facilities in Lagos State. All the clients need is to enter the facility, scan the pasted QR code, and several information about the facility will pop up, including the name and address of the facility, the name of the owner, the contact number of the owner of the facility, the approved scope of services by the facility. We also pop up because various facilities have services that have been approved by the agency. For example, the services approved for a hospital is quite different from that of a maternity home or a nursing home. So those information will pop up, and also the clients can also fill a form which will also pop up. And the client has the opportunity of feeding back to the agency his or her experience regarding perception of quality of care at that facility. And the agency will have access to this information real time. I will be able to intervene very promptly. And the benefits of this QR code system is that to improve the image of the healthcare system locally and outside Lagos State. Facilities will be able to enhance public trust in terms of privacy, hygienic environment, qualified staff, and functional environment. The agency can also use this public perception of the quality of care by clients, in addition with our own monitoring to rank health facilities in Lagos State. And the success story of this innovation include it will empower, it will enable the agency to gauge level of service providers' compliance to set standards of best practices in Lagos State. And as we are speaking, over 300 clients have forwarded feedback to the agency by scanning these QR codes in the health facilities. So the agency, with the assistance of the World Bank, has also done quarterly engagement with healthcare practitioners in Lagos State. The first one for the year was held at Dover Hotel on the 3rd of July 2025. The aim of this stakeholders engagement was to keep them abreast of the state government's agenda for the improvement of service delivery in the health sector and to build mutual trust between the agency and the healthcare providers. And also, the agency have been able to carry out several engagements with members of the communities. We have visited Kosovo local government area where a town meeting was held at the Kosisheri LCD auditorium on the 14th of August 2025. Another one was held at the Fakulty LGA on the 22nd of August 2025 with over 200 participants. And at Ajero local government auditorium on the 2nd of September 2025 with 217 participants. These stakeholder and town meetings have enabled the agency to interact with members of the community, explain to them the roles of the agency in protecting their health, as well as their own responsibilities in forwarding feedback to the agency regarding quality or any other awesome practices going on within their community. So thank you very much.
Thank you very much. Representative of Dr. Abdullah, very grateful. Thank you. Very quickly, ladies and gentlemen, we want to acknowledge the presence of the Honorable Commissioner for Commerce, Cooperative Trade and Investment in Lagos State. Ladies and gentlemen, please let's put our hands together for Mrs. Folashabi K. Andros. Please put your hands together for her, ladies and gentlemen. Thank you so much, ma'am. We acknowledge your presence. Without wasting any of our time, we have the next presentation on 2026 and beyond to be done by Dr. Honorary. It's going to be projected to us, it's currently connected to us on Zoom, so please your attention on this one. Thank you very much. Distinguished ladies.
Hello. Good morning.
We can hear you now, sir. Keep quiet.
We can hear you well. Oh, okay. Can you please put on the presentation?
Distinguished ladies and gentlemen, we apologize for the technical glitch. We're trying to get that fixed as soon as possible. While we are trying to get that fixed, ladies and gentlemen, we want to move very quickly and take some few goodwill messages. We want to start with Dr. Maya Ngon.
Thank you very much. Please confirm you can hear me. You can hear me. Okay. So, briefly, I'll be speaking on malaria intervention in Niger State, 2026, and the second slide. Go ahead. Let's move to the second slide. So I may have to use my own presentation because what you have on the screen is not moving. So I am not able to.
Hey, I have a continent.
Follow adequately. So I'll be using my hope you'll be able to. So the second slide.
Hey, I have.
Lagos State, it has reduced from 15% in 2010 to about 3.2% in our test and 2.6%
I have
in 2022. Now, preliminary data from the projects implemented by the WHO, National Association, and others seems to confirm progress in Lagos State. Now, although prevalence is based in Lagos State than most other states, it still records approximately 900,000 cases annually, because of the population of Lagos State. Even 1% prevalence is translated to huge figures in terms of number of persons that are affected and have malaria. Important also to note that even though the prevalence is low, there are some differences across locations. There are some spots that we have cases above 5%, and there are some population groups that we have cases that are also the prevalence is higher than 5%. Now, based on the data we have in the state, it appears that Lagos State is at the pre-implementation stage. Now, if we are already at pre-implementation stage, it means we should be aiming at eliminating malaria in Lagos State. And the goal in this case is to say, how can we get to a position where out of everyone as a person that is tested, just about one is positive. Now, if this institution in Lagos State prevalence is low in 2025, then what should we focus in 2026 and beyond? Next slide, slide 3. So this slide 3 just shows what I've said earlier. The prevalence is greater than 5%, okay, we were in control period, they were moved from control now to pre-emergent stage. And so the objective now should be how do we bring Lagos State to less than or about 0.1%. And it's going to be a total. So I'm going to share some thoughts on what we think we can do in 2026 and beyond. Now that we're aiming to achieve that goal of maybe 1% out of every 1,000 60. So here are some thoughts. I will establish them as two progress. The first one, what should Lagos do in 2026 and beyond? I'll group them into 3 or 4 buckets. The first one is we need to intensify some systems to report and investigate every case of pandemic in Lagos State. Number 2, the main thing is find and targeted transmission hotspots to interrupt local spread. 3, ensuring universal access to diagnostic and treatment services for all people, including mobile population. Of course, we are aware not people coming to Lagos and to live. And lastly, there is the need to strengthen political and financial commitments to the goal of the nation. So what does it mean to us? So we look at the first part, which is we need to improve surveillance. So what I brought up 4 things which I think are critical if we're able to intensify surveillance. Now it is easier to control malaria when in the general population, when maybe over 10% the prevalence of 10%, we are targeting most of the body. Then now that we're in critical stage of period, it means that intervention cannot be business as usual. It has to be targeted intervention. And so what are some of the things that we should do to be able to get that goal? The first thing that I surveillance is there's a need for that with an open-based reporting. There's need for prompt notification. So health facilities and community health workers must report confirmed cases quickly, ideally within 24 hours. And secondly, they need to be zero reporting. Even if there is no case reported, if it's agreed that on the daily basis, on a weekly basis, facilities or community or service is provided, those data should be reported. Even if it's zero data, it has to be reported. And of course, the deployment of ICT, including the use of mobile phones and tablets, and work with databases to help in enhancing the quality of data here. The second bucket under the people under intensifying surveillance is thorough case investigation. This include epidemiological data. Each case investigation should gather detailed information, including travel history, potential sources of infection, and locations visited by the patient. Remember, I mentioned earlier that when we move from control to pre-regulation, it is actually more challenging. It requires more than just general control. And so this is a very good example of that, because we need to try and look at every case by case and look at the history and other things to guide intervention. Then, of course, the need for time. A part of the thorough case investigation is a need for time. So case investigations should be initiated swiftly, especially for severe cases of those without a clear travel history to the pandemic area. The third thing that I want to look at on that investigation is the confirmation. A laboratory confirmation of the parasite species is vital for effective treatment and tracking. So those are 3 points I will bring that Lagos need to put in place now that we are at the pre-emergent stage under surveillance. The other 2 things that we need to keep an eye on as part of the testing surveillance is reactive case detection, and lastly, data analysis and targeted response. My question is, at this point in time, can we say that Lagos State has infrastructure, have the personnel system in place for us to say that we can actually carry out intensive online surveillance in Lagos State? It's a question for the House to think through, and if it is great, then it's important that we set up as soon as possible. Having discussed the issue of surveillance, the other is the need for prevention. Another prevention, I group it into two. The first one is the need for vector control. The other is the need for pharmaceutical the use of vaccine. So for vector control, we see that even though illness is very low, vector control remains very important as an option we can use to control malaria cases in Lagos State. One of that includes the use of insecticide treatments. Now, I think I was in a meeting in Lagos State with the immediate past national malaria coordinator, and he said something that was very striking, that in Lagos State, we really not need to do LLI campaign in Lagos State. What is needed in Lagos State is some of targeted deployment of LLI, and I think that is what we need to focus on. It's not just about every facility must distribute LLI or every community must have LLI. That is great, but I think what we need to do now is we must promote youth, but deployment must be targeted. Can we identify where are the weak spots and then do targeted LLI campaign? I think it's something that we still want to consider as part of the individual strategy. And the other one is indoor residual spray for areas that have been identified as high-risk locations and communities. Again, to contain the spread of the malaria, ensure that it is contained within that environment and doesn't spread outside. The other thing we want to consider as part of better control is about sustainability. And I think the good thing is Lagos State is one of those states that have benefited from the piloting and exercise. Is this something that Lagos State may want to pick up and run or scale as part of its strategy to eliminate in Lagos State? The next, I think that Lagos State may want to consider is some vertical and vaccine strategies. The state may want to consider other things to reduce prevention. One, I think that the state must continue IPT use among pregnant women. They must continue among pregnant children. One, it is protecting women, and of course, the children that are born. Vaccine has been introduced in a part of aware that it's quite expensive, but in places where we observe some cases, when Lagos State is willing to test the idea of deploying vaccines in those targeted areas. And of course, the active focal mass administration, which involves anti-malaria drugs to the population in a specific area around the disease case. Is it also something that Lagos State want to do that? So in terms of prevention, I said that mentioned two things, one better control, and the other one is consideration from political and vaccine strategies. But all have to be looked at within areas identified as endemic cases of malaria. Then in terms of treatment, Lagos State also be looking at targeted treatment interventions. And one of them is relative screening and treatment, which involves individuals who test positive for malaria when identified them and their households and neighbors are proactively screened and treated. Again, I'm talking about data earlier, and I'm going to say it again that when we come to this level that we are, which is the presidential stage, data becomes a key ingredient or a key consideration in program. For us to be able to do reactive screening, once an individual is identified to have a virus, we are seeing that people around that person, the brothers and sisters, members of us, the household, can they be reactively screened and treated for malaria? The second treatment is proactive detection in hotspots. In areas where malaria cases are known to cluster, people can be screened for the presence of parasites at regular intervals to detect infections anytime. Without that consideration, the government will to consider moving forward. Then the last treatment is mass drug administration. For highly persistent transmission in some areas, which of course we will get to know where you must have done some analysis and some better information to inform you You can't do targeted MBAs of full particular doses of drugs in the entire population. Similar to what happens in Sahel region, where we do this SMC medically to address malaria among a given person. So those are the things, some of the things that Lagos really want to consider moving forward as part of strategies to move from pre-elimination of quality and quality towards elimination. There are other things that we think we want to consider as moving part under integrated as strategies. Because we come to understand that data is good, but it's not enough. Prevention activities are good, but also not enough. And of course, treatment is also good, but not enough. We need a full lot of other things to help us to achieve the objective we want to achieve. And we've got to categorize that into 4 buckets. And the first one is the need for behavior change communication. And I remember on my commission that when we had this conversation almost about 2 years ago, we keep using the word engineering communication that is fit for purpose. I think now that ever before, we must have targeted the communication activities engineered to meet the peculiar needs of the state. Communication material must not be the same. It cannot be one size fits all. It must be targeted to meet the needs of Lagos State. And of course, the need for integration support. Interventions may want to combine malaria with nutrition support to address interaction between nutrition, anemia, and possibly others. Then, of course, the need for community engagement. Listening to Dr. Me, and also listening to Dr. Bimbo, and each of these strategies, using that to the farmer, there is a need for assessment community engagement. We need to keep doing this to ensure that there is greater ownership and greater commitment to the agenda of eliminating malaria in Lagos State. And of course, data. We must have a very robust system in place to collect data on a routine basis to inform planning and decision making. The last bucket on key interventions is around political and financial commitment, which are tied to the term strengthening political and financial commitments. There is no way that Lagos State will get to that destination if there is no political and financial commitment. And part of that is where the state to own it. You have already owned it, you just ensure that that ownership continues. And one of the ways that Lagos State can demonstrate ownership is looking at the projected availability for malaria elimination in the state. In as much as partners are going to work, and people continue to work, Lagos State must invest substantial resources to promote and address issues around malaria. I tried to look at the figure in the budget, to look at how much was allocated for malaria and how much has been released today. I couldn't really pick that. But you can do that for yourself. Look at the release of malaria in the state and ask yourself what destiny has the state actually released funds to address malaria issues. If it has great, but that needs to be sustained and that needs to be increased over time based on it. And of course, Lagos State work is not under conditions to meet these needs. One of those, and I keep saying that government cannot do everything, and the beauty about Lagos is that Lagos is very heavy on the private sector. We can leverage the resources in the private sector, we can leverage resources from philanthropies, we can leverage resources from communities to enhance work. All that promotes is a form of an arrangement in the government system in place that promotes accountability, that ensures transparency in the use of resources, and of course others. Then of course the need to strengthen financial management. People want to see money being used for what it should be used for. And lastly is the need to expand insurance coverage as part of efforts to address Now, Lagos State will have health insurance, and I'm sure that the treatment is started. I'm not sure of the coverage of health insurance in Lagos as of today. In most cases across the country, what we are the coverage among the informal sector is usually a little bit low, very low compared to what you observe in the formal sector. So what can we do to bring the informal sector to the pool and then they have access to the recovery and services. The last point is to leverage on other intervention. I'm a very strong advocate that we cannot continue over single interventions in this country. We must see how we can integrate Nigeria. There's no reason why institution services, economic planning, and the whole of products cannot be integrated. Can we integrate services and leverage on the resources available through this trend to address the issues of money, to take Lagos State to that point where we say Lagos State's Lagos State has been limited. So how can the impact be leveraged? Impact project. Of course, Lagos State is well positioned in terms of support from impact project. Lagos State is one of the states that are implementing the project. It's one of the states also where we are conducting the resource management effort. We are also implementing Component 2 of the impact project. And of course, you have political will in Lagos, and you have been very creative, having used resources, and I've mentioned it several times. The impact project did not come to you with the feast idea of what should be done. Resources were made available, and you were considered to say, this is only available. Tell us what you want to do to achieve a successful project. And you have really been very flexible and have come with great ideas of what you want to do. So those things are there, and I think it's looking for you. The project will be closing, supposed to close December 31st this year, but there are efforts to extend the closing date to December 31st, 2026. I think that the project resources can be leveraged on one, to help properly define the pathway to the initial in Lagos State. There were a couple of things I mentioned today, looking at the need for us to have very robust process in place, identify that, then of course treatment issues, prevention issues, and all that. It's possible that we're having this some things, and of course the work by doing with SFP, the management, using digital as something that we can do. But I think Lagos needs to come together in a very, very technical session to map out how to eliminate malaria. And you want to lead the intervention around some of these plots or ideas that actually in case you find them helpful. At the same level, also want to cover using part of the resource sector is strong and strengthen the surveillance. So in case that's a priority, something of considering, especially as you relate to malaria elimination, is something that you can consider along the way. Supporting, generating, and analyzing data to inform critical steps is demonstrated to get to the elimination stage. Of course, there is need for capacity building on need basis. Personally, on need basis to ensure that we have a relevant scale to move from pre-eliminated elimination. I will say it again, I've said it before, doing control is not easier than moving from pre-eliminated elimination because you need skills, you need people to invest data, and you need people to present fast and do reintegrated intervention. Then lastly, evidence-based advocacy to strengthen political commitment to the goal of eradicating malaria in Lagos State. Now, these are some of the factors in terms of what we can do in Lagos State in 2026 and beyond to actually move Lagos State from pre-elimination to elimination. It can be done, and I think with the caliber of people in Lagos State, with the resources available, with the political will that we are already seeing, Lagos State can be the first state in Nigeria where we say that malaria is eliminated. Thank you very much.
Thank you very much. So very quickly, ladies and
I don't know whether
very quickly. Please look to your neighbors, sit to your right and to your left, and give them a very warm compliment. Tell them they do so good. Tell them they do very good. Look to your neighbors, sit beside you, the woman. Yes. Look to your very handsome. I'm not telling you to compliment someone else's husband or someone else's wife. If your neighbor sits beside you is very complexion, Ladies and gentlemen, if you're able to step beside this very confidential, say to him or her, you're the light of the world. I can hear you very well. Say to him or her, you're the light of the world. And then if you're able to step beside you, you're down with confidential. Ladies and gentlemen, if you're able to step beside you, you're down with confidential, say to him or her, there's light at the end of the tunnel. Or better, say to him or her, let's get the light. And your words, thank you very much. A round of applause for yourselves, ladies and gentlemen. While Dr. Oluwaye's presentation was going on, he made mention of some things, and part of the things I picked up was saying Lagos State is one of the 6 states implementing the malaria components in the impact project, and if we put all resources together by the end of this project, December 2026, Lagos State will be #1 out of all the states. And I believe Lagos State will be right, because you know Lagos State leads another state to do what? Lagos State leads another state to do what? You get it? If you don't get it, please don't forget about this one. You need to get this one perfectly. Ladies and gentlemen, we have so many people that have benefited from this program so far, from this project. We have video testimonials from them, and I want us to fix our attention on the screen as we show video testimonials from so many beneficiaries from this impact project. Please fix your eyes on the screen. As soon as we're done with these testimonials, we'll move very quickly to Google messages. Thank you very much. Distinguished ladies and gentlemen, now we get to this fixed, we want to move very quickly to the goodwill messages, and we want to start with the representatives from World Health Organization. Ladies and gentlemen, if your hands are not too busy, may I request that we put them together as a big welcome, Dr. Maya. Please put your hands together for her, ladies and gentlemen. Thank you very much.
Good morning, Honorable Health Commissioner and distinguished colleagues and public health colleagues. So my name is, please let me stand on the existing protocol. My name is Nia. I am a team lead for disease prevention and control to WHO Nigeria. So I'm very honored to extend a warm greeting from World Health Organization on behalf of Dr. Alex, our WHO representative. So he is not unable to come to Lagos this time. And because many speaker has been spoken, and then you have also seen a lot of progress. If we remember this project, this initiative started early this year, then when we started, it moved very quickly. So there are also several steps. You might have seen that the initiative reached out to the private sector. They have demonstrated the engagement with the private sector, the engagement with the PDLD, the community pharmacy, and then that's also set up the referral that go to the primary healthcare PHC. This is also the center of the attention for Nigeria as well as at the global level. So that's also set up the example of this, and a collective effort that will also strengthen and go into the strengthening of the health system, and that will also lead to the saving life. And if we all look at all this achievement, ongoing achievement, then it could not be possible without the strong leadership from the Lagos state government and the commitment from the federal ministry through an MEP and a delegation of the partner. We are also very grateful to World Health, World Bank, Measurement, Society for Family Health, the Pharmacy Council of Nigeria, and many others. So as WHO, we are very proud to be a technical partner. We want to reaffirm our commitment to work with you, and we also take the suggestion from the World Bank. There are several options that we can think about, and then we can further discuss. As a WHO, we will also bring in the best practices, the global guidance, and then compare with the option, and we can further discuss what can be adapted in labels, and that will go beyond, as mentioned. So let us build on the gains and renew our commitment, and then all the innovation should be transformed to measurable improvement, and that will lead to the improved health outcome. So we would like to wish you the fruitful discussion and continued success. And we will be together until we reach the vision of malaria elimination in Lagos. Thank you. Thank you very much.
Thank you very much, Dr. Mayambo, the representative of the country rep of the World Health Organization, Dr. Alex Gasasira. Ladies and gentlemen, next on the list for the Global Message is the representative of the Registrar of the Pharmacy Council of Nigeria. If I enter not to busy, I request I will put them together for pharmacist Daniel, the representative of pharmacist Babashir. Please make it louder, you can put it together for her. Thank you very much.
Thank you. Good day, ladies and gentlemen. Permit me to stand on the already established protocol. I'll be reading the goodwill message by the Registrar Pharmacy Council of Nigeria, Pharmacist Ibrahim Babashir Ahmed, at the midterm review of the IMPACT project, the journey from pre-elimination to elimination of malaria in Lagos State. It is with great delight that I bring you warm regards from my humble self and the management team and staff of the Pharmacy Council of Nigeria. Kindly accept my sincere apologies for my absence at this crucial event of the midterm review of the IMPACT project. It is due to an equally important ministerial assignment of which I have undertaken as the team lead a few weeks back, and now requires the report of my stewardship to the coordinating minister. However, the able lieutenants of the PCN team who have worked with this project closely on the ground. Today, I recall with nostalgia the launch of the project, signaling the journey from pre-elimination to elimination of malaria in Lagos State that took place on March 4th, 2025. The launch was a promise made to the good people of Lagos State, and I am glad that we are here to review how well the process of fulfilling that promise is coming along. We are happy to note that the recent results that show a positivity rate of 5.9% correlates strongly with the prevalence rate of about 1%, which was reported at the launch of the project at that time. We congratulate Lagos State because this implies that the state is truly in its pre-elimination phase, and that the possibility of malaria elimination no longer seems strange, especially if the right strategies are sustained. Consequently, I pledge on behalf of the PCN our support to the Lagos State government in sustaining the needed strategies to achieve malaria elimination in the state. Flowing from the outcomes of this review, we will do the needful and provide the enabling regulatory environment to ensure that the promise made at the launch to the good people of Lagos State is delivered to the stakeholders in the private pharmaceutical sector. The Council is ready to partner with the government to ensure that the trainings that have been provided for these stakeholders are made available on a wider scale, as well as to ensure that their practice and operations align with best practices. These objectives also align with the vision of the Pharmacy Council of Nigeria. Finally, I commend the commitment of His Excellency, the Governor of Lagos State and Chief Host of this event, as well as an amiable partner and friend of the Council, the Honorable Commissioner of Health, Professor Akin Abayomi, for his passion and his grit to see this through. I wish you very productive deliberations. Thank you very much.
Thank you very much, ma'am. Distinguished ladies and gentlemen, for the next goodwill message, I want to specially welcome someone we all know very well. He's a legislator of great repute. He's a former member of the National Assembly and is currently the chairman of the University of Abuja Governing Council. Ladies and gentlemen, if our hands are not too busy, for the next goodwill message, let's put hands together for Senator Larry Tedrosho. Please put hands together for him, ladies and gentlemen, as he comes for his goodwill message. Thank you so much. Please, we can make it louder. Make it louder. Thank you so much, everyone.
Thank you very much. Welcome to College TV. I believe I was just ambushed 1 minute ago, but I was looking to be part of the panel this afternoon. I don't want to repeat what I was saying up to now, but what I will say is elimination of malaria. It's a problem that we have to introduce a new strategy to emphasize the eradication of mosquitoes more than the eradication of malaria. I would have expected we have malaria-free Lagos on that side and mosquito-free Lagos on the other side. Because we have been battling malaria for decades, years, and we are still where we are today, having conferences and so on. All the countries that have eliminated malaria as it is, they targeted the mosquitoes strategically, which I believe we need to upgrade our efforts to that of eliminating the mosquitoes at the source, and also to see how we can make the mosquitoes we have in the country friendly. We have mosquitoes in some other countries that are friendly, that they do not give any malaria. So I thank the organizers, and I'm sure as we go along, we'll have more things to discuss. Thank you very much.
Thank you very much, distinguished Senator Larry Tedrosho. Ladies and gentlemen, next on the list of goodwill messages is the Director of Public Health, Federal Ministry of Health, Dr. Godwin Intadom, ably represented by Dr. Nse Apan. Please can we put our hands together for Dr. Nse Apan, ladies and gentlemen. Thank you very much.
Thank you so much, the Honorable Commissioners, and our dear distinguished Senator, dear President, all dignitaries, please permit me to align on the well-established protocol. I bring you greetings from the Auditing Minister of Health and our dear Permanent Secretary. My name is Dr. Ansep, and I'm representing the Director of Public Health, Federal Minister of Health. I want to start by congratulating Lagos State for a job well done, because over the years, we at the federal level were worried. If we don't work toward elimination of malaria in Lagos State, then we will not be able to achieve in any part of the country. We knew that Lagos State accommodated virtually every ethnic group of Nigerians in this country, and the hub of commercial activity as far as the rest concerned. So we knew the prevalence of malaria, how it used to be in the past. But today, we can say, nationally, Lagos State and other states of the country, the prevalence is dropping and making progress. So we say that we are working working toward pre-elimination stage, we can beat our own matches and give ourselves a round of applause. Thank you, Lagos. Now, having said that, there are still some things that we still need to look toward it. We have been listening to a series of presenters today, and I want to remind us today that malaria is not a program that we used to say that it should be only from a facility alone. Today, we have been engaged both the PPN, PPMP, and all those CPs. I'm talking about the community pharmacy. Also, have it at the back of your mind that the antinos in the community, the yalago in the community, we should not be shy away from this. When it happens, the first point of view that we will call are those people. Before the patient will now remember, oh, it was a severe malaria. Let's seek intervention or treatment at a secondary or primary health facility. Why do we still down our training to cover these classes of people and bring it on board so that the community will be well equipped for managing this program? We are aware that diagnosis is one of the major things that we need to deal with. Yes, we have the outreach, but the coverage is still level the huge time. So we should step down more to the community level for community ownership. Sustainability is one of the missions. Today we know also that the World Bank project will soon end. How are we planning toward sustaining this program? It will not be only the federal level, the state have a role to play, the local government have a role to play. And under sustainability, the community should be the one that owns this program and sustain it very well. So the community should be aware on how to manage malaria, simple malaria, severe malaria, complicated malaria. The community should be well equipped to do this. And when we talk about this, then another challenge that we know that we will face is resource mobilization. How are we planning to ensure that there will be resources for us to run this program effectively? Because the impact project will not be there. We have been aware of what happened when the US government decided to downplay us. Thanks to this administration that they stepped in and saved the situation by pulling some resources to the three major diseases that is affecting this country, talking about malaria, TB and HIV, and other diseases. Now, once the impact project is over, the state have to look towards this. The local government have to be involved. The community have to be involved. All can have to be on there. We need to put that resource and ensure we save life. So it's not something that we will dwell on government alone. And I can tell you, if we think in this direction, we will be able to make headways. And I'm sure that Lagos State, of course, like the speaker already said, we always need other schools. Lagos will not fail Nigeria, and if not fail Nigeria, then other part of the country will not fail. Thank you so much.
Thank you very much, Dr. Nsingapa. Very grateful. Distinguished ladies and gentlemen, just like I said earlier, we have those that benefited from this project so far. And we want to share your testimonials with every one of us here to see how well we have done so far. Media, are we ready for this? We have testimonials. Please stick your eyes on the screen as we take the testimonials from those that benefited. Thank you so much.
He said that because when people come in to buy malaria drug, no, we don't sell malaria drug anyhow, okay? We give them advice to run tests before buying malaria drug. For anyone that is positive among them, you give them free malaria drug. And they go out and tell themselves they are the one even pronouncing the program more. And the more we do it, the more they bring people to us, to which has really helped my business more and more close to Lagos State. appreciate is that they can even test before just they can to find and regarding. And when they tested positive, they get the drug, they really appreciate it. And I myself, I make more customer because of the people come out and they come out and I have to check myself to check and do that. They get the drug, they really appreciate it from my community. And because of that, I really find my channel because they don't pay for this program. And I pray that God will continue to help me to take this to the next level. Thank you very much. Because I think it's a good plan for me to work with people. Thank you very much. Thank you very much. My name is Mrs. So, once it's very easy. I will take this money, so we came here with the and tested through stop also because the drug free, and I was so happy because when I brought food here, I was crying, but I thank God for what he did. It was for free. I will not pay anything. Say, is free. With the drug, with everything is free. Even with my elder son, we came together and it is everything free. So I really thank everything. I take this program, I take us to government, for what we do, and do very well. I pray for them and God will do what is going to be done more. Amen. Thank you. My daughter came here for the malaria test and it was positive and they give her malaria drug free. And I came here this morning because I was feeling weak. Come and do the test and I did the test, it was negative. And Sharon told me that, and realized me that not every time I'm feeling weak, I will be taking malaria drug. I really appreciate about this program they are running and active. In fact, it was I have malaria. Give me malaria drugs and antibiotics.
Lagos State government mandates we test before we treat.
Oh, really?
Shall we do a quick test?
I am sure it is malaria, but okay, let's test.
You do not have malaria. Fever can be a symptom of various illnesses.
Wait, what's making me feel like I have malaria?
I will put your information now and with your test results to the Ikate Primary Healthcare Center. Your details and test results are already with the PHC at Ikate. They are waiting for you. There's a medical.
Ladies and gentlemen, I think Lagos State deserves a round of applause for this very wonderful initiative and how well people have benefited. Please put your hands together for Lagos State government. Put your hands together for Lagos State government, ladies and gentlemen. Very quickly, who will tell me the meaning of PTTT? PTTT. Who will tell me the meaning of PTTT? I have. You said what, man? I can hear you. Please say louder. Prevent, treat, test, and what? Please put your hands together for yourselves. There's a check under your table, under that particular table, yes. There's a check of 10 million right there. If you can't see it there, you can reach out to the Honorable Commissioner for Health. He will do the needful, yes. Thank you very much, ladies and gentlemen. Very quickly, we want to go ahead with the goodwill messages. And we want to take the representative from the Society for Family Health. Ladies and gentlemen, please put your hands together for Dr. Jennifer Ayanti. Please put your hands together for her, ladies and gentlemen, as she comes for the goodwill message from SFH. Thank you very much.
Honorable Commissioner of Health of Lagos State, Professor Environment, the Honorable Commissioner of Commerce, Lagos State, to the back, Mrs. Ambrose, I'd like to stand on existing protocols, but of course I must definitely mention one of our board chairs, so one of the members of the board of Society for Family Health, Mrs. MNI. Good morning, sir. And of course, you know that since I don't want to be sacked, definitely I must mention, I'd like to greet also all esteemed stakeholders here, especially the permanent secretaries from the Lagos State Ministry of Health, Dr. Gwe, good morning, sir, and good morning all to other stakeholders also. On behalf of the Managing Director of the Society for Family Health, I'd like to screen very warm greetings from SFH. I'd just like to say we ask you to pass across this apology, sir, to you and to His Excellency the Governor when he does come in, because there's also another meeting going on in Abuja where he had to be there, and I have a feeling that the Honorable Commissioner of Health is likely to be flying out later today to attend that particular meeting, which is also on malaria. I'm honored to be part of this midterm review of the Lagos State Malaria Impact Project. SFH is a partner to the Lagos State Government on Component 1A, which was presented by Dr. Shinomo, and also a partner to WHO on Component 1B. This gathering, of course, is a testament to our collective commitment to combating malaria and improving the health and well-being of Lagosians. We're all testament to the impact, and I'm somebody who is very interested in research, and I have been seeing the excellent results that have been coming out from the state as a result of the program that is taking place, both in the 1A and the 1B. I commend the Lagos State government for its leadership and vision in tackling malaria. The efforts to strengthen the health system, as we could see in Component 2, and also access to quality health care, and to promote community engagement and yield positive results. The Malaria Impact Project has made significant strides in reducing malaria prevalence, improving diagnosis and treatment, and enhancing community awareness. Sometime next week, the Honorable Commissioner of Health will be doing a press briefing to launch the campaign on media awareness that talks about prevent, track, treat, and what's the fourth one? Prevent, track, treat, and trace. Amen. Being an organization that works at the interface between public and private sector, we at SFH are so excited to see the leadership role that is being played by the Lagos State Ministry of Health in bringing a sector-wide approach to the area of malaria prevention, treatment, and control. As we review progress and challenges in this meeting, I would like to urge us to remain focused on our shared goal of a malaria-free Lagos. Let's continue to work together, both public, private, and community level, leveraging our strengths and expertise to overcome obstacles and accelerate impact. Esteemed stakeholders, I express our gratitude for the administration of Lagos' support and commitment to this project. Your leadership has been instrumental in driving progress and mobilizing resources. To all development partners here present, to all stakeholders, community leaders, members of the medical profession, the private and the public sector, I'd like to say that your tireless efforts are producing results and your contributions are evident. Your collaboration and expertise has been invaluable and will continue to be so. But we shouldn't give up here. Let's push on the momentum generated so far. This is midterm. We still have some way to go. And let's continue to push forward with renewed energy and commitment. While prevalence may be dropping, we must not keep our eyes closed to the fact that there could be a resurgence if we don't continue to work hard. Together, we can achieve a vision of a healthier, more prosperous Lagos, free from the burden of malaria, as we've seen that it is possible. Yes, I believe we can. Thank you very much.
Thank you very much, Dr. Jennifer Ayansi, the representative of Society for Family Health. Ladies and gentlemen, next on the Google message list is the chairman of the Nigerian Board for Meds. If our hands are not so busy, distinguished ladies and gentlemen, please put them together for Pharmacist Ibrahim Yakasai as he comes for his goodwill message. Please put them together for him, ladies and gentlemen. Thank you very much.
You will pay 10 million naira for murdering Maisha. Maisha means life. All protocol of that. It is with great pleasure and indeed deep sense commitment. I stand on behalf of my to give this good message. It is very important for midterm review of impact projects. What can I say? Lagos has done well. This is an impact project with one vision, commitment, resilience, and it is happening. I'm from Kano, but maybe I will get to Lagos. Honestly, this is a very remarkable achievement. We're talking of 5.9% positivity rate, aligned with 1%. That shows we are going to elimination by the grace of God. It's not enough to be at a pre-elimination, but I'm sure with God we are going to reach there. With hygiene, we are going to reach there. The success story is not only the government, I'm so happy the communities were involved. The healthcare professionals were involved, even though I saw only paper medicines vendors on the screen. Pharmacists, doctors, all of them involved in this project. But my prayer with right strategies, with collaboration, which is so powerful, with the innovation, that is the idea of measurements. They believe in technology enabling machine gadgets to make sure we have another report. So with that, I'm sure we can be having a project that can be sustained. The success, I must to say, yes, the state governor did a lot, but we must give kudos to the Commission of Health for Professor Kinabara. Mosquito doesn't want to see Professor Kinabara. Fears him. Malaria, sometimes I call him Mr. Malaria. Honestly, my child is proud to be part of this journey. We will continue to be with you. We will reaffirm our commitment. We will continue to support you in any way possible that you think we need national. And I want to pray to Lagos State. May Lagos State continue to be the model for malaria-free society in Nigeria, Africa. For all of you who attend this program, may you be blessed pharmaceutically. Thank you very much.
Distinguished ladies and gentlemen, I believe we receive the blessings pharmaceutically, right? Have we received this? Receive your blessings pharmaceutically in Jesus' name, inshallah. And you're going to say what? Everybody will say what? Thank you very much. Thank you so much, dear pharmacist Ibrahim Yakasai. We are very grateful for that very short and brief goodwill message. Next on the list is a brief presentation on scaling malaria pre-elimination through digitization, AI, and sustainable financing, the Meds model. Ladies and gentlemen, please put your hands together for the CEO, Meds, Dr. Jessica Vernon. Please put your hands together for her, ladies and gentlemen, as she comes to a brief presentation. Thank you.
Thank you so much for having me, Your Excellencies, and everyone in Lagos State and Nigeria. We're very keen and excited to present on the results of this program, and very keen to begin to think about what comes next for Lagos as we enter this next phase of planning. So the Pathways Project has very clearly shown that the Pathways Project has very clearly shown that Lagos has entered the elimination phase. So test positivity rate across this program is about 5%, which is a huge milestone. And very exciting that it has come down from a 15% prevalence rate in 2010. We're able to see these results because of appropriate testing and treatment across the private sector. All of the testing being done in this program is audited by AI, which enables accurate test results being reported to the state and being able to help with really clear decision-making for where to allocate resources in the future. We're able to see at a pharmacy level what the test positivity rate is. It's all geotagged, and this can help Lagos begin to allocate additional planning resources in terms of other things that might be needed for elimination in the future. This program is highly cost-effective relative to other options. We're able to measure on a per-patient basis exactly what's being done and only pay for results rather than for inputs. And because of that, Lagos is able to reach this goal of elimination of malaria with the proper resources for this next phase. So, as you all are very aware, I'm sure, the private sector is where the majority of patients are going for malaria care. These patients are often getting treatment without testing for this, and many of them don't need the treatment that they receive. We have built digital tools that help these patients to get appropriate diagnosis and treatment by helping the providers to have better protocols. We support high-quality care. We enhance tracking and transparency of healthcare commodities by serializing every commodity that is delivered to a patient. And then we just generate actionable data that help the sector to understand exactly how to allocate resources. This can improve patient outcomes tremendously through cost-effective solutions. So I'm showing you here a map of real-time data that is being captured by this program. And as you can see, while there's 5% test positivity overall in the program, it varies quite a bit by the part of Lagos that is accessing care. And so we're able to drill down several layers deeper to be able to help identify exactly where malaria is being transmitted in Lagos. This can help with things like distributing nets in a more targeted way, helping with chemo prevention, and other things that can help Lagos achieve elimination. To give you a bit more information about my genetics, we started in 2017. We're in 5,000 sites across 4 countries in Africa. So Kenya was where we started, but Uganda, Tanzania also have operations in addition to Nigeria. And we're supporting about 25 million patient encounters annually. We're also growing quite rapidly, so hoping to be in about 10,000 sites within the next year or two. And the solution includes 3 parts. So it's business management software to help a pharmacy, clinic, or drug shop do everything that it might need to do to manage its business. Then we build on top of that a digital reimbursement system. So that's what powers this malaria program in Lagos. So this digital reimbursement system provides the treatment protocols for all sorts of types of healthcare needs. So we also support HIV, family planning, and diagnostic programs, vision programs. And we ensure that patients are able to access the care, and then the pharmacy is reimbursed appropriately. And then we have large amounts of actionable data to help with decision making across the health sector. To give you a little bit of a history of my genetics, we started in 2017, as I mentioned. We started with research as kind of the core of what we do. So the first thing that we did was a large randomized controlled trial in Kenya that showed that this approach to supporting malaria testing and treatment could lead to much better outcomes than the status quo. We then started scaling and have reached about 1 million patients to date. across our 2 countries of operation. And we're now working in partnership with governments in many places to help them to be able to leverage this platform to make much better decisions for the future. So we're especially keen on the partnership with Lagos and have learned a lot from being able to partner with you all, and are hoping to be able to take this thing that has been built in Lagos and expanded to other parts of Nigeria as well. And our ambition is to be everywhere where there's malaria and other important health needs, helping patients access appropriate care, and to make sure that providers are able to have the tools that they need to do this. The way that the system works is that the patient will visit a pharmacy to access, in this case, malaria treatment. The pharmacist will offer testing first to make sure they actually need that treatment, which of course here we know they might not. And then the results are verified by AI using AutoA to make sure that the test result is actually positive or negative as reported. We built a claims management platform to help providers verify that the appropriate things have been done. So we use a platform that we call Medai to do this, and then we only reimburse verified claims. So we make sure that the patients are real, that the transactions are real, and that the patients are accessing the care that they need. For the malaria flow here, the way that it works is that a patient will come into a pharmacy or PPMD in the usual care. The patient will just go in and buy an antimalarial directly. And in many cases, this leads to worsening illness, wasted costs, substandard drugs, and sometimes resistance as well. In this program, we incentivize the use of testing before treatment and enroll the patients in the program at the point of care. We work with SFH in their facilities for this, and then providers are reimbursed for the care that they're providing. The results are verified by AI, and referrals are happening to the public health. And it's highly cost-effective in terms of overall value burden and death burden. We have real-time dashboards that Lagos State is using to look at that into the Nigerian data systems sometimes to be able to have that real-time data there as well. We're also to help them with proper diagnosis of AI. So the goal here is to be able to have the provider get direction on what additional 3 questions they should be asking to the patient to make sure that they're not missing something or that there's another diagnosis that shouldn't be considered. This will also help with continuous learning and other things, and we're really excited to launch this in the next few years. And then finally, all of this works because there's the ability to finance it in different ways. And so Lagos State has done a fabulous job with, and it will make an impact project to bring this to life. And we're thinking about ways to be able to continue this work in the future. So in this new funding environment, having domestic government resources is an important fundamental piece of the puzzle. In addition, global philanthropy is still quite interested in supporting many of these things. So we're building funds that are able to use domestic resourcing to unlock philanthropic funding and vice versa, to have a blended capital fund to scale this in Lagos and elsewhere. We're very excited to do this with malaria, HIV, and potentially some other disease areas. And so the goal is to be working with several different tech solutions and vendors, not just ourselves, to enable service delivery in the private sector. Have them then make sure that the pharmacies and clinics are providing proper care, and then the patients receiving really high quality care at a very low cost. We see this as the future, and I'm very keen to engage with all of you on how to build this. And finally, this is such a critical time for Lagos State and for Nigeria to be thinking about the future